Hello there, my friends. Today we're talking about a topic many men avoid, but one that shouldn't be ignored: prostate cancer. It's one of the most common cancers in older men, but the good news is it's also one of the most treatable when caught early. Before we begin, please take a second to hit the subscribe button. If you care about your health, wellness, and longevity, you'll want to be part of this community of strong, wise, and informed seniors. We're in this together. Let's begin with the basics. What exactly is cancer? Cancer happens when certain cells in your body begin growing out of control. Normally, your body replaces old or damaged cells with healthy ones, but sometimes, due to age, genetics, or environmental factors, that system breaks down. Cells grow when they shouldn't, forming tumors. In prostate cancer, this starts in the prostate gland, a small walnut-shaped organ just below the bladder. Its job is to produce some of the fluid in semen. Now here's something important. Prostate cancer often grows slowly. Some men can live with it for years without even knowing they have it, but other times it can be more aggressive. That's why knowing the early signs is so important. It can truly save lives. So, who's most at risk? Well, let's look at some general risk factors. Age is the biggest one. If you're over 60, your chances go up significantly. Most prostate cancer cases are found in men over 65. Next is family history. If your father, brother, or uncle had prostate cancer, your risk is nearly double. African American men are also more likely to develop prostate cancer, and often at a younger age. Lifestyle plays a role too. Obesity, smoking, and a poor diet can all increase your risk, and some researchers believe chronic inflammation or hormonal imbalances may also contribute. Now that we understand the risk, let's talk about the 7 warning signs you should never ignore. Warning sign. Number 1. Frequent urination, especially at night. Are you waking up multiple times a night just to pee, or suddenly needing to go more often during the day? Frequent urination, especially at night, is one of the earliest and most common signs of prostate issues. Now, this doesn't always mean cancer. It could be something like an enlarged prostate, which is common as we age. But if it's new or getting worse, it's definitely worth checking out. Talk to your doctor. You're not bothering anyone. You're being wise and proactive. If you found this helpful so far, please like this video and make sure you've subscribed. That helps us reach more people like you. Warning sign number 2, difficulty starting or stopping urine flow. You get to the bathroom, but the flow is weak, or it takes a long time to get started. Maybe it starts and stops, or you feel like you can't empty your bladder completely. This happens when something like an enlarged prostate or a tumor is pressing on the urethra. Again, not always cancer, but definitely a sign to bring up with your healthcare provider. Warning. Sign number 3, pain or burning. During urination or ejaculation, if you feel a burning sensation or pain when you urinate or during ejaculation, don't ignore it. This could be a urinary tract infection, or it could be prostatitis, which is inflammation of the prostate. But if it persists, it may also be an early sign of prostate cancer. In fact, some studies have found that chronic inflammation of the prostate may be linked to a higher cancer risk. So if it's been going on for more than a few days, or if it keeps coming back, make that doctor's appointment. Warning. Sign number 4, blood in urine or semen. This one can be alarming, and rightly so. Seeing blood in your urine or semen is not normal at any age. It can be caused by infection, kidney stones, or injury, but it can also be a sign of cancer in the urinary tract or prostate. Please don't wait. Call your doctor right away if this happens. Even if it's just once, it needs to be investigated. Warning. Sign number 5, erectile dysfunction. Erectile dysfunction becomes more common as we age. But if it starts suddenly or worsens without explanation, and especially if it comes along with other urinary symptoms, it could be a warning sign. Prostate cancer can affect the nerves and blood flow related to sexual function. Don't be embarrassed to speak up. Your doctor has seen and heard it all, and your health is more important than your pride. And hey, have you subscribed yet? I'm here each week with real talk about senior health, healing, and living well after 60. Warning sign number 6, pain in the lower back, hips, or thighs. Now, many seniors experience aches and pains, but persistent or deep bone pain, especially in the lower back, hips, or upper thighs, shouldn't be ignored. Prostate cancer often spreads to the bones. That's why this kind of pain, if it doesn't go away with rest or keeps getting worse, needs medical attention. According to the National Cancer Institute, bone pain is one of the most common signs of advanced prostate cancer. So listen to your body. Warning. Sign number 7, unexplained weight loss and fatigue. Have you lost weight without trying? Feeling tired no matter how much you rest? These could be signs that your body is fighting something more serious. Cancer uses up your energy and breaks down your body's reserves. While fatigue and weight loss could come from many things, like thyroid issues, depression, or even medication, they are also signs to take seriously. If this sounds like you or someone you care about, it's time for a full checkup. Now let's shift gears for a moment. I want to talk to you about something just as important as knowing the signs, what you can do to protect yourself. Here's the good news. There are real proven steps you can take to lower your risk and take control of your health. First, get regular screenings. The PSA blood test, prostate-specific antigen, is a simple test that measures a protein made by the prostate. Elevated levels can be an early sign of cancer. Doctors may also perform a digital rectal exam to feel for abnormalities in the prostate. If you're over 50 or earlier, if you have risk factors, ask your doctor about how often you should be screened. Don't wait for symptoms. Be proactive. Second, eat a prostate-healthy diet. That means more fruits and vegetables, especially tomatoes, which are rich in lycopene. Cruciferous vegetables like broccoli and cauliflower also support detoxification and inflammation control. Choose healthy fats like olive oil, avocado, and nuts. Limit red meat, processed meats, fried foods, and sugary snacks. Many studies show that diets high in antioxidants and fiber can help protect the prostate. Third, move your body. Just 30 minutes of walking a day can reduce inflammation, improve circulation, and help balance hormones. Physical activity has been linked to a lower risk of aggressive prostate cancer, so dance, stretch, walk, or garden. Just keep moving. Fourth, maintain a healthy weight. Excess fat, especially around the waist, is linked to more aggressive forms of prostate cancer. Set small, realistic goals. Every pound lost helps. Fifth, quit smoking and limit alcohol. Smoking affects your immune system and damages blood vessels, making your body less able to fight disease. If you smoke, talk to your doctor about quitting. Drink alcohol in moderation. no more than 1 drink per day for men. Sixth, manage stress and get quality sleep. Your body heals when it's at rest. Chronic stress and poor sleep weaken the immune system and may increase hormone imbalances. Try meditation, music, deep breathing, or whatever helps you relax. Aim for 7 to 8 hours of sleep each night. And seventh, don't ignore symptoms. Even if something feels mild or comes and goes, write it down. Track your symptoms and bring them up during your doctor visits. Many prostate symptoms overlap with other conditions like infections or enlarged prostate. Only your healthcare provider can tell the difference. Bonus tip: stay connected. Talk with your loved ones. Share what you've learned. And if you belong to a senior center, men's group, or church, bring up the importance of prostate health. You never know who you might help by starting the conversation. And speaking of helping others, please share this video with someone you care about. A brother, husband, friend, or neighbor. You might be the reason they catch a problem early. Don't forget to hit the subscribe button so you never miss another senior health video from this channel. To everyone watching, thank you. Thank you for caring about your health. Thank you for being part of this community. And thank you for sharing your wisdom, your time, and your trust. You're never too old to take control of your health. You're never too late to start healing. And you are never alone on this journey. Stay strong, stay informed, and stay well. Until next time, my friend, take good care of yourself.